Yeah, so we're here at the Ritz-Carlton in Orlando, in Florida, and I'm standing here with Dr. Kirk Gair, which is one of my favorites on the chiropractic scene and the sports scene.
Thank you, thank you.
Very nice to meet you.
Nice to meet you in person as well, too.
Yeah. And we've been working in the Nordic region with chiropractors and therapists in different areas.
Right.
And you are one of the pioneers when it comes to work with the low-level laser from Laconia. And on the performance side with sports, etc.
Right.
So can you please tell us about what kind of outcomes you see?
Yeah, the outcomes are really, they're mind-blowing, and that's not exaggerating at all. So we have a lot of the athletes who will come in initially for injuries, and where I practice in Southern California is one of the hotbeds of talent in the United States. So we have a lot of kids who come in who are some of the top ones who go off to play professional sports, play at high-level colleges, and here in the U.S., kids when they're playing, they go year-round. They don't take a break. So like let's say if they're playing baseball or track or whatever kind of sport, they're going to go 52 weeks a year. And so we're seeing all these injuries at very young ages. Some of them where they're told at 13 or 14 they'll need like a Tommy John surgery. Kids are already getting on medications at an early age, and then some of them are being told not to play anymore because chronic injuries, etc. So these kids usually show up at my clinic as I'm like their last hope. Like they come in kind of like the scene from Star Wars where Princess Leia is the hologram, not R2-D2, and says, "Help me, Obi-Wan, you're my only hope." That's when a lot of these athletes will come in. And so they'll come in with, say they're looking at a shoulder surgery or an elbow surgery, and we'll go through and use the lasers, and we have such a high success rate of helping these kids heal without needing the surgery that there's one orthopedic surgeon in my town near me that forbids his patients to see me before they have a surgery because he's had too many of them cancel, which it's cut into his bank account. So he doesn't really like that. So they'll come in for that. For concussions as well too, we'll do things to get their brain to heal, from their function better, and then usually they stick around for sports performance because what they notice is that, hey, you know what, I had that injury, not only is that injury gone, but now I'm throwing the ball harder than I used to, or now I'm running faster than I used to. And I had one particular athlete who had chronic hamstring strains, and we worked with him and did things with a laser and did some neuro rehab with him as well. And not only did we get him back when he was told to take the season off, he ended up running the fastest time in our nation last year, and it was like the 8th fastest in U.S. history.
I think I read about that.
Yeah, and then he went down to the Pan Am Games, and his team, they set a world record in the 4x400 meters, and he won a gold medal. And this was a kid who, then was even interviewed on TV. Hey, you ran faster than ever before after these injuries. How'd you do it? And that's the thing is we use the laser to enhance his performance as well.
It's super cool.
Yeah.
We actually just got the words that the Norwegian Olympic team in skiing are starting to use our lasers.
Yeah.
Congratulations, Sweden. Now you're going to have a difficult winter.
Yeah.
And you are involved in different kind of teams as well.
Yes. Yeah.
Can you tell us about something about that? How you manage to work with the team?
Yeah. So what we'll do is we'll have the athletes will come in a lot for performance enhancement.
Yeah.
So a lot of people don't know there are studies that show that there was one particular one in the Journal of Biophotonics in 2017 and another in the Journal of Athletic Training in 2017 as well that show that athletes who get regular laser therapy have bigger muscles, stronger muscles, they're faster, they have faster recovery times as well, and they have more endurance. So this one study particularly, their conclusion said it was as if these athletes had performance-enhancing drugs, but didn't have any of the side effects, and it wasn't illegal, like a performance-enhancing drug. And their conclusion was, we're not sure this should be allowed in international competition because of this unfair advantage. So what athlete doesn't want an unfair advantage that's not going to harm them? So we'll have a lot of the coaches will send in the groups of their athletes, their main athletes that, let's say if they're going into an important game, like a playoff game, or especially if here in the U.S. where we have kids getting recruited to colleges, if they're going to some of these what's called a showcase, where they're going to get seen by scouts, they'll come in beforehand a couple times that week and we'll do specific laser recalibration protocols to make sure their upper and lower extremities firing optimally, things to kind of balance out the nervous system. And then we do a laser shower on them too, to where they're actually laying down under the Laconia FX 635, and we'll have 3 lasers rotating around the chest, the abdomen, and the legs, so we can maximize energy production, ATP production, nitric oxide for improved blood flow, glutathione to decrease inflammation, and stimulate stem cell production as well too. So we see these athletes performing at amazing levels. What's interesting, I had one athlete who was coming in regularly for this. He came in initially for a back injury, playing American football, and we did the laser on him, got him back to performing when they told him he was going to have to not play anymore. But he wanted to keep coming in for these kind of tune-ups to maximize his performance. And so we were doing this every week, and his parents said, hey, we want to do a trial. We want to take this week off. What do you think? We take this week off from the laser and see how he does. I'm like, totally, let's do it. Let's do a good experiment on this. So he takes that week off, that Friday off from coming in to see us, plays his game that night. I have a phone call from his parents on Monday morning, and they said, that's the last time we don't do the laser before a big game, because they said it's not that he played bad, but they said they noticed that when he got like 3/4 of the way through the game, they just saw his energy tailor off, and he wasn't moving as quickly, he wasn't performing as well. When he gets the laser, he performs at a peak level throughout the whole time, and so that's really exciting to see. People of all ages performing better. I play in what we call weekend warrior kind of tournaments out here, American football, and I'll go. I'm almost 50, I'm a few months away from that. I'll go and I take my laser and I laser myself before I play. I laser all my teammates, and even some of the other teams will see us and say, hey, that's not fair. You guys have a laser, you got an unfair advantage. I'm like, well, that's right. I bought the laser. You could do the same thing as well. But it keeps me playing at a high level to where I can still throw the ball really hard enough that it still whistles. And you can't always say that when you're almost 50.
Yeah. Great to have you here.
Well, thank you so much.
Thanks a lot.
Thanks for having me.
Hopefully we will see a lot more of this within the next 10 years.
Absolutely. I think we're really on the verge of a big transformation.
Yeah.
So really laser is like a disruptive technology.
Yeah.
If we look historically, there's certain technologies that come out that change everything.
Yeah.
You had the horse and buggy, and then the car came out. And
Yeah.
when it first came out, everybody's like, who needs a car? Why would you want to go and have to buy gas when you can just feed a horse some hay and they're good to go? Who drives a horse and buggy anymore? Like nobody. And then you had things like you had the telegraph, and then the telephone came out.
Yeah.
You had silent movies, then talkies came out. Then you had TV, and each time it's something new, people are saying, who wants that? Remember 20 years ago it was all pagers. Who has a pager anymore? Nobody does. And then it moved into mobile phones, and they took off. And then you had where video stores got replaced by Netflix and streaming, and Amazon has replaced brick and mortar. And I really think laser is going to do it. I've been doing it for 15 years. When I first started doing it, that was when people were like, oh, what is that? That's some crazy kind of lights. How's that going to affect anything? And we're now at this point where it's starting to. There's so many research studies, you can't deny the fact that it works.
Yeah.
Now it's just a matter of it catching up as far as in people's minds. And as we see more of these stories of people's lives being changed, and you guys are able to talk about this over the internet and reach people throughout the world, I think within the next 5 to 10 years we're going to see a huge paradigm shift. And it's exciting to be at the forefront of it. I love the work that you guys are doing.
Yeah, the same to you.
Awesome.
Yeah.
All right.